Have the doctors on.
Hello, everyone. Mary Esther Miranda Gilbert here, back again, saying hello to everyone out there. Thank you for being here. Tonight, our topics are going to be about the supplement that's circulating out there called methylene blue. So I'll tell you about the history and how it's used medically, and I'll also back the very heavy scientific research that is uh, questioning its safety for as a supplement for supplement use. So we'll be going over all of that. And also, we're going to be touching on the subject of why information is being hidden from the public as far as um, what nutrients do for the body and how they can help a person improve their health. So, there's a lot of information that is being kept from the public. That's the general consensus in public opinion. And from what I have gathered, it seems to be the case. So we'll be covering that briefly also. Alrighty, so I'm going to go ahead and share my screen and we'll go ahead and get started. Okay, topic number one. Research studies on methylene blue supplements, scientific conclusions and warnings about its use. And let me go ahead and change our view here. There, I can see both of us there, Gail.
Yes.
All righty. Okay. So scientific conclusions and warnings about its use. So what is methylene blue? I'm going to be abbreviating it to MB so that it's not such a mouthful every time because I bring this term up quite a bit here. So MB is an FDA-approved substance for managing and treating methemoglobinemia, despite its contradictions. Now, methemoglobinemia is a condition that occurs when the ability of hemoglobin, the protein in red blood cells that normally carries oxygen from the lungs to the body's tissues and organs, is decreased. Researchers conclude that there are possible adverse effects and contraindications for applying MB as a therapeutic agent in methemoglobinemia and other therapies. So now let's talk a little bit about its history. Historically, it was first used in 1876 as a textile dye. Scientists use MB to stain microorganisms for diagnosing infections. So when they looked at them under the microscope, they were able to distinguish where the microorganisms had been embedded in tissues at the cell level. So in 1891, it was found to be useful for malaria, making MB, quote, the first synthetic compound ever used as an antiseptic in clinical therapy and the first antiseptic dye used therapeutically. So that's straight out of the quotation there. Medically, MB is used off-label, so the FDA has approved it for working on the methemoglobinemia, but physicians have also found other uses for it. So they're what is called off-label use. So it's been used for vasodilatory shock when the body is unable to deliver sufficient blood to the brain, heart, and kidneys. And it's an antidote to cyanide poisoning. Also, it's photodynamic therapy for psoriasis and chronic wounds. Also, it's used for staining tissues in cancer management for identifying the cancer's location in the cells in the body. Also, it's been used for easing pain of oral mucosa membrane inflammation due to radiation therapy to the head and neck or with chemotherapy. Now, this is all taken from the scientific research, and I always list my references. I'm not a medical doctor, so I don't diagnose, treat, or anything like that. This is for information purposes so that people can be more informed as to, being able to speak to their doctors about their health management and make very highly informed decisions about their health. Although there are many indications for administering methylene blue, reports have identified potential adverse effects. Researchers stress the critical importance of coordinated efforts among medical professionals in the caring of patients receiving MB. So MB has been used for staining tissues pre-operatively and post-operatively for, like, say, the thyroid glands. or in the colon tissues in a colonoscopy, which creates a contrast allowing detection of polyps, precancerous growths, and inflammatory bowel disease. Other proposed MB uses include as an anti-malarial agent, memory loss, dementia, and as an anxiolytic, something that helps a person deal with stress. Medical uses according to newer converging scientific evidence, with effective use being dose dependent. So here are some of those examples. It's found to have mood stabilizing properties, again, anxiolytic, shows possible neurotropic efficacy, enhancing or influencing the nervous system, may aid cognitive performance, learning, and memory, increases mitochondrial oxygen consumption, boosting ATP or cell energy production, ATP being the unit of energy the body produces to do all of our cellular work in the body, or any kind of work that needs to be done to maintain the body. So scientists have found that lower dose levels of 0.5 to 4 milligrams per kilogram appear to be beneficial. So a milligram per kilogram just means the concentration or dosage of a substance relative to your body weight. However, higher doses greater than 7 milligrams per kilogram results in the opposite effects. So it may have some therapeutic effects found by the medical profession and also according to the scientific literature. But it's also, if it's used in higher amounts, then it can have the opposite effects on a person's health. And this is what the scientists have found. They have found that anything greater than 7 milligrams per kilogram results in, it may slow or inhibit mitochondrial energy production. So up here, used in small amounts, it's been found to enhance energy production at the mitochondria level, which is the cell, the organelle inside of our cells that is the energy producing factory. So if it's anything higher than 7, then it's going to slow or inhibit energy production in that mitochondrial. It also may affect cerebral perfusion, and that means the pressure that drives blood flow to the brain, ensuring it receives adequate oxygen and nutrients. So, it may have a negative effect on the circulation of blood flow to the brain. Also, research data on how MB affects the brain is limited. So as much research as I tried to do on this subject this week, I did not come up with any definitive and conclusive studies that show that MB should be used as a supplement. There are companies out there that are manufacturing it in supplement form, and they're using, what seems like medical language. And we will go over a couple of examples of those kinds of supplements, and so you can see what I mean. So the research data on how MB affects the brain is limited. It affects effects of MB on the brain's oxygenation and metabolism is not yet established. So there's not enough study, there's not enough scientific research out there to come to any conclusion. Some research shows MB induced a reduction on cerebral blood flow and reduced oxygen delivery to the brain. So in other words, it reduced oxygen and blood flow to the brain. So researchers have concluded that both human and rodent imaging data suggests an inhibitory effect methylene blue has on the brain. However, the most beneficial effects on the central nervous system warrants extremely small doses, much lower than those used for methemoglobinemia, which are, again, the lower dose levels of 0.5 to 4 milligrams per kilogram. So researchers have found that it works best if it's much smaller amounts. So researchers agree that more research in quantitative imaging studies on MB's effects on cerebral blood flow and metabolism is required to determine any potential therapeutic central nervous system applications. So here are some more documented or known adverse effects, which include bluish-green urine discoloration, limb pain after IV administration. So if someone's in the hospital and an IV has been administered and they're, getting methylene blue through their bloodstream, they've experienced pain in their limbs afterwards. Also, other adverse effects have been reported. It may contribute to serotonin syndrome when used with certain medications. Increases sympathetic nervous system and neuromuscular activity, bringing on side effects of diaphoresis, clonus, and tremors. Also, people have reported, and medical reports have said that patients have experienced central nervous system related dizziness, confusion, and headaches. So, MB in neonates, newborn children, has been associated with hyperbilirubinemia. It's a condition of excess bilirubin in the blood. So, bilirubin is a yellow pigment waste product produced during the breakdown of red blood cells and processed by the liver, and it's eliminated from the body through bile and stools. In newborns, their livers are not fully developed and cannot eliminate bilirubin efficiently. So MB has that effect on their little bodies, their little systems. Also, newborns have experienced impaired breathing or respiratory depression, a condition where breathing becomes abnormally slow or shallow, potentially leading to insufficient oxygen and excess carbon dioxide in the blood. Another problem would be pulmonary edema, abnormal fluid buildup in the lungs alveoli, the tiny sacs that are at the end of the bronchioles or smallest branches of airways in the lungs where oxygen and carbon dioxide exchange actually takes place. So all that breathing we do, it has to be all that air, oxygenated air, has to travel all the way down to the very ends of the lungs where the alveoli is sitting there. They look like little grape clusters if you've ever seen diagrams or photographs of them. And that very end is where the oxygen and carbon dioxide takes place. So we breathe in oxygen, we exhale carbon dioxide. Okay, so also a problem with newborns having had MB in their systems is phototoxicity. Now that means when a substance in the body or topically on the skin interact with the sun's ultraviolet light, and that's what causes skin damage in some people. Also, hemolytic anemia, a condition where red blood cells are destroyed faster than they can be replaced in the body, leading to jaundice and other blood conditions as a result of damaged hemoglobin and erythrocytes. So again, the scientific literature has come to many conclusions, especially in the area of MB being administered to neonates or newborns. So this is a very controversial subject, even within the medical community. And physicians have understood by now that they need to collaborate or coordinate or communicate with each other just to make sure that the patient that they are handling has not been exposed to methylene blue, and if they have, what dosages and how they even the scientists have also reported through the medical literature that they have to make sure that if someone an adult is on medications, then they also have to understand how much, if any, methylene blue has been administered to their patients. So contraindicated in those hypersensitivities or anaphylaxis, which is a severe, potentially life-threatening allergic reaction that occurs quickly, affecting multiple organ systems, including the respiratory and cardiovascular system. So, that is something to be considered too. Someone can go into anaphylaxis shock. Also, it's contraindicated in pregnant women. Now, I highlighted this in red. The FDA assigned MB as a pregnancy class X rating due to intestinal atresia, which is the blockage anywhere along the intestinal tract, and fetal death following intra-amniotic injection in the second trimester. So these are the conclusions over time that scientists have tested and come up with. Also, another big red flag is medical research indicates that MB is safe at a dose of less than 2 milligrams per kilogram. However, levels greater than 7 milligrams per kilogram, there it is again, I was redundant in posting that amount, results in adverse effects. So I'm going to show you what the supplement levels are out there, and anyone who has this information now should not consider, or should seriously reconsider the dosages that are being sold on the market. So cautions against MB are also for those with renal failure due to it reduces renal blood flow, reduces the blood flow and circulation through the kidneys. Cautions against MB are also for those with renal failure due to its, I already read that, right? Reduces renal blood flow. Alrighty, so researchers have stated currently there is no existing antidote for MB toxicity. Now, there is some promise that I will go over shortly. And again, this is all pure scientific research data that I'm telling you about today. I'm not making any medical claims. Application of MB should immediately stop if anaphylaxis occurs, and medical care must be provided promptly. Anyone knows that if anyone has ever had anaphylaxis, then they know that they must get medical care, emergency medical care. So MB may potentially be fatal when combined with drugs that increase serotonin due to its monoamine oxidase inhibiting properties. So anyone who has been on any kind of medications like that, their physicians need to be sure that they are schooled in the fact that MB should not be anywhere in the picture. Serotonin toxicity occurs at doses greater than 5 milligrams per kilogram. So, we have to really watch that. I'm sure MDs are aware of that out there. At least I hope so. So now, Methylene Blue's black box warning states that concomitant use of MB and serotogenic drugs and opioids potentially puts one at risk of serious serotonin syndrome or is fatal. Again, scientists, different groups of scientists have come to this same conclusion. So here's some contradictions in science reporting. Methylene blue health benefits versus adverse effects. So here is an example of a research study that may not be accepted as in a peer-reviewed review of many different studies that an expert panel of reviewers would consider as a legitimate study or would be eliminated from their review, which is the most credible kind of scientific research that one can gather. If you're doing any research on any particular subject, particularly in our case here in the nutritional field, on botanicals, for instance, then a peer-reviewed study that has gathered, sometimes they start out with looking at over 1,000 or more, more than 1,000 different scientific studies, and they have to narrow it down. Sometimes I've seen studies be narrowed down to first they eliminate 500, then they'll eliminate another 300, and then they're down to maybe 60 studies where they can base their report on. So knowing what the rigorous scientific standards are is very important for these, well-qualified reviewers that produce these kinds of reports. And you can find them. You can do a search on the internet on your botanical that you're interested in and just type in the word Science Journal, and you will see, and especially if you type in Science Journal peer-reviewed studies after your search term phrase, then you will come up with those peer-reviewed studies. And that's when you know you've got the cream of the cream kind of information to share with others. Okay, so now here's an example of something that looks pretty legitimate, right? But it contradicts what the other scientists have said. So I didn't find any peer-reviewed studies on methylene blue. More research is required to gather enough data from various scientists all over the world to see what conclusions they have reached. And so far, what I've given you tonight are what the conclusions have been so far. Okay, so in this case, in this one, it's titled The Potentials of Methylene Blue as an Anti-Aging Drug. Okay, so now when you see this title, something like this, then you're automatically going to think, all right, these scientists are going to try to prove to the reader that methylene blue has been tested rigorously and maybe has been tested by other scientists with the same conclusion. That it is indeed an anti-aging drug, but this is the only data that I've been able to find so far that claims this, right? So let's see what they have to say. This is something that, this is why I have this institute, so that people can be very, very discerning as to what they're putting in their bodies. There's so many infomercials out there, and they make it sound so official sometimes, and they want you to buy a certain supplement. But when you look at the ingredients, it's something, maybe a biochemical the body already makes, or it's an individual compound that's beneficial for your health that many, many plants have. And so if you eat the plants rather than buy the very expensive $100, 30-day supply tablet, then you'll get much more benefit out of it. Much more benefit, because plants are so synergistic. They have so many different compounds in them that they act synergistically on the body, and they have many, many different benefits that address the nutritional needs of all body systems sometimes. So anyway, getting back to this thing here. So first, of course, when you have a research study, they're always going to provide an abstract or a foreword describing and defining, what methylene blue is in this case, and its history, so it's talking about the history here. And they're going to give you some keywords. So those are the things that you want to do. It's like if you want to search the whole document, you can do searches on these keywords and get more information that way. So also, then they have an introduction, right? And so they're talking about how it was originally used as a textile dye, which I already, found in other scientists' reports. So, and then they'll give you a nice diagram of how it works, outside the cell membrane, inside the cell, and how the different phytochemicals sitting on the cell membrane are working. I go over this kind of information quite often, so I'm not going to elaborate on it here. And to me, I think this is one of the, perhaps, one of the research studies that would not be accepted in a peer-reviewed study because of its contradictory information. Okay, so as you go through, the scientists love to talk about structure and functions, which, in this case, it's about the mitochondria, the energy producing organelle that are within our cells. And so they're talking about the mitochondrial electron transport chain, which means nothing other than ultimately it produces an oxygen molecule or something like that, right? So it's talking about this redox reaction that occurs when molecules get broken down in the body. So that's not something that's already well established, scientific information. So they're not going to be, putting in any real contradictions there. They do provide a lot of their references, so it would be good to kind of take a look at what the other individual scientists have been doing on methylene blue. This group of scientists happen to be studying the Staphylococcus bacteria, and how methylene blue has an effect on that, for example. So there's many little other, smaller types of groups of scientists that have been studying this, but for different reasons and for different outcomes in their research. But what we're looking for is it safe, and does it cause anti-aging? So now, in this section, they're talking about brain aging, and they're going to explain the science as to what makes brain age, right? Lack of oxygen. And in my research, I have found that there are many other factors, nutrient deficiencies and things like that, eating the wrong types of foods, the wrong types of fats, things like that. But they don't talk about that here, other than the antioxidants that are present in certain things. And they're not talking about any botanicals in this case, although the scientific reference, the research on botanicals is quite extensive. If you've been following my work at all, you'll know this, that I've been doing this kind of work for a very long time. So anyhow, they continue to just talk about the different diseases, what happens in the body molecularly. So far, they haven't really done any proving as to how it causes anti-aging. You can go ahead, and I provided this link to you so you can read this article at your leisure. But yeah, they're just talking about different things. To me, they're not actually proving that it works. And I've been diving into the scientific literature for so long that I know the difference. Sometimes they explain exactly what happens at the cell level and what a compound or a botanical or anything else will do for the cell, and how it, in this case, perhaps might improve how the cell functions and how it replicates, and how it's able to maintain its youthful kind of behavior in the body. So I don't see anything like that here. So then they're talking about skin aging. And again, they're just describing aging. The skin, it's one of the it's actually the largest and most complex organs and primary defense, in the external environment of your body. So then, they're talking about the epidermis, the dermis, and subcutaneous, levels of the skin. And okay, yeah, you haven't told me yet. How does it cause anti-aging? They're not talking about any kind of nutrients yet. Like I said, I've seen enough scientific references to see just how nutrients act on our cells and just how they can be anti-aging because they keep the cell working in a more youthful manner. Okay, so again, I mean, I don't know if you're a fast reader, but I've seen this stuff for so many years and I already know what they're talking about. I can skim it quickly. Um, and then they're talking about a treatment for a specific disease, right? So now they finally come to their conclusion, or at the end of it, where they have a discussion. So they're saying aging is a complex process with multiple contributing factors. Yes, we know, right? Um, so they said it's a review, but it doesn't say it's a formal peer review. They call it a review. See, this is a trick too. I mean, there's trickery everywhere in every single area of our lives. So we really have to educate ourselves and be able to discern the differences and ask the questions if something seems contradictory or it doesn't seem right, if it opposes something that you have gathered and thought it was, true scientific data, then it's okay to question it. And please do. We have to question these things. So then they also say no cure is fully developed for most neurodegenerative diseases. Again, they're talking about neurodegenerative diseases, all these different health conditions, but they're not saying how to reverse aging, right? They didn't mention that here at all. So, they could say, they're saying, MB treatment could still enhance memory. Yeah, that information is out there, but it also, and some of these very responsible studies that I saw, and I'm presented in the document that we're going over tonight, um, has shown that there are contradictions, and especially having to do with that is dose dependent and used medically. It's very important that it be administered responsibly. So again, I'm coming to the point where I'll show you a couple of supplements that are out there that are way, way over the safe limits that these scientists are talking about. So I was very unsatisfied with it. And here's another one. Whenever you look at a scientific study, there's a conflicts of interest section. And if it says no conflict of interest, this very simple, no elaboration on it. It should just say, we declare no conflict of interest. But they kind of dressed it up a little bit. And to me, it looks like they do have a potential conflict of interest because they mentioned KC as the founder of this laboratory, a private corporation that sometimes wants their scientists to produce a certain outcome, which is very biased and may not be factual. Okay, so this is a biotech company that focuses on skincare and public health. So do these biotech companies, are they connected to, MBlue Labs? Are they a subsidiary? Are they, producing products that will sway the public into believing that their products are good for them? So to me, this is a red flag as well when you look at a scientific research. And just because they have references doesn't mean that, again, is it proving that methylene blue is anti-aging? So far tonight, I've covered what the scientists have found and how it's being used in the medical profession. But as far as I'm concerned, I would not use this as a scientific reference. So there are good scientific references and there are not so good scientific references. And for all I know, they could be very legitimate, but it doesn't look like it to me because if they're connected to a corporation and maybe, if we did a deep dive search on what these corporations do and what what they're all about, then maybe it could be acceptable. But so far in my experience over these decades, that when you have a private corporation connected to some kind of so-called scientific study, then it's usually not legitimate. And that's what the peer-reviewed studies are for. They will probably would reject something like this if they knew for sure that this was not an objective kind of study. And they didn't even touch on, to me, it was just a misnomer. They just should have named it something else. The potentials of methylene blue as an anti-aging drug, where they didn't defend that position at all. Okay, so enough of that, but I could really do a deep dive on that subject. All right, so now let's go on to the next part. Botanicals used to remove methylene blue in practical applications other than humans. So I didn't find any research that has shown how botanicals can actually detoxify or help the body detoxify methylene blue. Okay, so I know that the research has demonstrated that if you take methylene blue over a period of time in larger dosage, then you're going to have those kinds of adverse effects that we've already covered, that the scientists have already discovered. So here are some possible, that's my words, and this is also in agreement with what scientists have said, that and also industries, they have used botanicals because they know that they're able to adhere to synthetic chemicals to remove impurities out of their products. So in this case, there's been some use of methylene blue, as an industrial, solvent, you can say, that will remove impurities in certain things that they do industrially, right? So here's one that they came up with, sweet basil. Research indicates that sweet basil can absorb methylene blue dye from water with higher removal rates over longer contact times. While this doesn't directly translate to human detoxification, it suggests a potential interaction that warrants further study. Now, I know for a fact that peer-reviewed studies have shown that many of these botanicals contain the phytochemical compounds, essential oils, or whatever those molecular substances you want to that have been named, will adhere to molecularly bind to synthetic chemicals in the body and help the body neutralize them and eliminate them through the various eliminative organs of the body. So I know that much is true. I have shown that through my scientific references in the books that I write and also in the presentations that I do, regularly. So the science is there showing that these botanicals can eliminate some toxins, specific toxins out of the body, because that's where the research has focused. So we know that much about them. But as far as what these particular botanicals that I'm listing here, what they can do as far as removing methylene blue, that has to be proven scientifically before any company can make any claims out there about them. So again, cilantro, I personally have long known through the research I've done that cilantro can remove aluminum from the body, and a lot of scientific data shows that test subjects who have had things like dementia or other health issues having to do with the brain and nervous system have been applied cilantro and shown that it can remove those toxic chemicals out of the body. So, and this in this case, it's known as a natural chelator. In other words, it binds to these toxic chemicals. That is the phytochemical compounds in these plants, cilantro, namely here, can bind to or chelate to these chemicals. So cilantro has been studied for its ability to remove heavy metals like mercury and lead from the body. While methylene blue is not a heavy metal, cilantro's general detoxifying properties could be relevant. And notice the language used here, could be, right? Requires further research. So anytime you see someone reporting that scientifically and they use those terms, then you can trust it because they're not making any claims. They're just saying, here's the research so far, and this is what the scientists think by association through their huge base of knowledge, being able to make that intuitive leap or just a knowledgeable leap of information, right? So also milk thistle is widely recognized for its liver detoxifying properties, since the liver plays a crucial role in processing and eliminating various substances from the body. Supporting liver function could be beneficial. Another term, could be beneficial. Garlic and onions. These vegetables contain sulfur, which is found to aid the liver's detoxification processes. So they're quoting the already established scientific research on these botanicals. So methylene blue supplements, let's take a look at a couple of the supplements. Uses of MB as a supplement is available to the public. However, the only FDA-approved use for treatment of methylglobin, did I say that wrong? Methemoglobinemia. So that's the only FDA-approved use for it for the treatment of that health condition. So causes of methemoglobinemia is apparent by blue-tinged skin. Again, I'm being a little bit redundant because it's leading into, the claims that that claims that companies who produce products are making. Exposure to certain medications, chemicals, or recreational drugs. So those kinds of exposures can also cause this condition. Ironically, MB is a bright blue color. It causes in this health condition, it causes blue tinged skin, but yet the substance is actually a bright blue color, and so the scientists say, isn't that ironic? So how MB treatment helps? It increases hemoglobin's oxygen binding, oxygen carrying capacity. So they have some of the scientists have found that, oh yes, indeed, it does help improve the blood's oxygen carrying capacity. Short-term medical use of pharmaceutical grade MB in a controlled setting by a medical provider is in marked contrast to buying an unregulated supplement and taking daily amounts, leading to toxicity. So again, they're saying caution. They're issuing cautions to the medical community. Stay in contact with each other, all of you medical professionals, if you're working with the same patient, make sure that your patient is using the regulated amount or the approved amount of MB. As a supplement, though, MB is marketed as enhancing mitochondrial efficiency. So what do you think consumers are going to be doing out there? They're going to think, oh, okay, I want more energy. Wow, it helps my mitochondria produce more energy. And the commercial sounds credible. The person is in a white lab coat, maybe, or sounding very authoritative, or even saying, scientists say. I mean, there's so many tricks of the trade in advertising that convince people to buy a product when people maybe don't even know very much about how their bodies work and what their bodies actually need, and how to be more discerning over information received like that. So that's what we're here for in this institute. This is what I want to awaken everyone to, the kind of knowledge that you need to manage your health properly and be highly nourished and highly successful, and not be tricked into anything that might be potentially toxic. Alrighty, so it's advertised on one product label as, quote, boost your energy and metabolism, enhance your cognition, improve your mental health and mood regulation. Now, anywhere in the scientific literature nowhere in the literature did I ever find anything having to do with the endocrine system that regulates the hormones that regulate mood. I haven't seen that even discussed anywhere. It might be somewhere. If I spent maybe another month researching the subject, I might uncover more and dig up more. But so far, that's what came up in the searches. So anti-aging and antioxidant properties. Okay, so we've already seen a little bit of what the scientists have found. And if in the right doses, in short periods of time, it could have that effect. But too much of a good thing or too much of a potentially very bad thing, your body can handle small amounts of things like this. But if it's not a nutrient, then it's not going to tolerate very much, and there will be side effects. Okay, so let's take a look at a couple of, here's the last bullet point this company said: unlock mitochondrial supremacy. Now, these kinds of terms are not scientific, they're not provable. They're just superfluous, right? There's superlatives that they use to get the product sold. So this is like a subconscious implantation in the brain, so to speak. Supremacy. Wow, I want something supreme for my body, kind of thing. I want supreme energy. I mean, these are the kinds of subliminal messages that are being, brought across to people. So here's the first product that I wanted to look at with you. And it's called, well, I don't even have to name it. I'll just show you the dosage. Take a look at the dosage, 150 milligrams per dose. Are you kidding me? So again, I just kind of took a quote from what this label already said. So this is kind of redundant down here as to what their claims are. So let's take a look at their laboratory analysis and analytical test reports. I'll just take you to the website quickly. And maybe I need to shrink us down a little bit so I can see the end here. There you go. Okay. And I can't see everyone. Hi, everybody. I saw you all come in. Welcome, welcome. All right, I'm just going to have to move this whole window over then so I can see everybody better. Bear with me here. There, I can read that much better now. Hopefully you'll be able to see that without it being too offside too much. So this is the product that this company has on their website, and they're selling this particular product. They have other products too, but this is the one I'm evaluating here. So methylene blue, 150 milligrams. They don't tell you what the ingredients are. They don't tell you what the dosage is. It must say that somewhere on the bottle, but they're not showing you the reverse side of this bottle. They're not showing you the label. Nowhere on here does it say, anything. Right? They're pretending like they're the experts. They're posting maybe frequently asked questions here. Of course, all their answers are going to work toward their benefit to make the sale. And then, there's a couple of other things that make the website look pretty, right? And here they are saying again, boost metabolism, optimizes body's metabolic efficiency, enhances cellular energy. They're using all the buzzwords that people are learning out there. Improves ATP production for increased energy, cognition and neuroprotection. So they're making all these claims, and they're not backing themselves up with any kind of scientific data. And even if they did, the FDA would not approve that. Supplement companies can't do that, according to the FDA. If supplement companies are very responsible and they want to present the scientific evidence, the peer-reviewed science, the very solid science that has been going on over time, over perhaps botanical formulation, the FDA still does not allow them to make quote unquote medical claims. So the definition of medical claims is very loose and is obviously, to the advantage of the medical industry or the industrial complex, I should say. I don't know if that'll get me knocked off of YouTube again or not, but I'm trying to be very careful what I'm saying here. Again, I'm not a medical doctor. This is purely for information purposes. Okay, so again, they're making all these claims. All righty, so let's see. No, I can't shrink it down. So let's take a look at this document very quickly again here. And I don't know if I can enlarge it well enough for you because there's no enlargement feature, but it might be a little blurry, but what they have here is just the nutritional breakdown of minerals. So they're talking about, no, again, they're misnaming it. They're saying this whole line of essential minerals the body needs, and some of them are what the body does not need. It contains some of the toxic metals as well in this formulation. So this is their report of their laboratory analysis. So it has, a little bit of sodium, magnesium. It has aluminum, which is a toxic metal. It has potassium, calcium, chromium, manganese, iron, copper. Those are essential minerals. It also has arsenic and cadmium and lead and mercury. Those are certainly not something that your body needs. Very toxic for the body, and very severe health problems can ensue. But they call the whole list heavy metals analysis, and that again, they're lumping in the essential minerals in with these toxic metals. So again, something is not right about this company or this report. Oops, did I knock it off? I think I did. Let me go back to my document here. I'll get back on it. Oops, I think I clicked on the wrong one. Yeah. That's coming up soon. Okay, so another thing I wanted to say is, all right, let's take a look at their other official document. Gee, they make them look so legitimate, don't they? So I'm going to enlarge this so you can see this better. So this is another analysis of their toxic metals down here, arsenic, cadmium, mercury, and lead. And then up above, they did an analysis on the microbial count, which is, it's an FDA law that all supplement companies have to test their products for any kind of microbials that might cause illness. And then they don't have any analysis for their methylene blue substance here. So, this is a very incomplete, I've seen much more elaborate, test reports. So I don't know where they got these people to test, their products. Okay, so that's a quick rendition of what to look for in any kind of product. You know, what company is it? Is there science behind it? What is the science behind it? Is it legitimate science? Is it peer-reviewed science? These are the kinds of things that you want to make sure you can do your highly informed research about. Okay, so this is the other formulation that I wanted to take a look at real quickly. And so this one is called Methylene Blue Physician Guided Prescription. $99 per month. They want you to get on this product and receive it every single month for $99. Okay, so I'm going to go back to that page, and this is their website. So it looks to me like, okay, is this a medical website? Methylene Blue, and in small print, they say physician guided prescription. Now, is this a prescription? Will a doctor prescribe this particular product? It doesn't say. They're just showing, very briefly, prescription methylene blue may offer mood enhancement, mental clarity, and increased energy. May offer, not does offer. Clinical studies have shown potential for supporting cognitive function and memory. That part is partially true, but they don't say it's dose dependent and used under very strict supervision under medical care. May improve mitochondrial function and reduce fatigue. May, again, it's like, okay, we're keeping ourselves from getting in trouble here, so we'll say the word may. That's a very standard, non-committal kind of word. An antioxidant that protects cells from cellular aging and may promote collagen production. Again, I didn't see anything in the scientific literature that said it has been tested on animal or human subjects that help them improve their joints, their collagen in their bodies, help produce more collagen in their bodies. I did not find any scientific research to that effect either. Okay, so then this again, you look at their URL up here and it just says join.tryeden.com. It looks like a corporation to me. It doesn't look like any kind of a medical clinic or anything like that. It's called Eden. Okay, so they've got other products obviously here, and they will give you a personalized, safe treatment plan. Who's qualified to do that safe treatment plan, and what is the dose? They don't tell you. They don't tell you what the dose is. They just barely even show you an idea of what methylene blue, capsules might look like in their product. So, I mean, if we were to shorten this URL, maybe we could come across with more of their website, right? So I'm going to delete the rest of this long URL. It's very long. Okay, so let's see. This is the kind of work that I do all the time. When I present something to people, I want to make sure they're getting the right information and they're getting something that's safe and efficacious and already proven, through peer-reviewed studies. Peer-reviewed studies are the irrefutable kind of science that you need in order to back yourself up whenever you advocate something. So let's see if we can come to their main website. So it looks like if it's the same people, it looks like the same people, the same logo, the way they spelled and the font they used for the word Eden. So anyway, but I don't see their methylene blue products. They're just talking about weight loss, strength, hormones. It may not be the same company, or it could be a subsidiary. Who knows? It's very fishy. If you can't get to a company's legitimate website who plainly lists their products, lists their ingredients, and even if they're going to list all those health benefits, they should show some kind of scientific research, right? And the right kind of research. So as far as I'm concerned, these kinds of products just don't cut it. They're not going to be advocated in any way whatsoever, especially with so much questionable, research out there that the scientists have concluded. Okay, so it concludes topic number one. I don't think we have much more time, although we did start a few minutes late. So very quickly, I want to cover topic number two. For all of you out there watching this video, I'm hoping that you hung in there with us and are getting a lot of information that will help you make the decision about whether to use methylene blue in your bodies or not. I personally wouldn't touch it. There's nutrients and phytonutrient compounds in the plant kingdom that will address so many of your cells nourishment needs and therefore help them function optimally. So as far as censorship, okay, some of you who might have social media, sites out there and have accumulated subscribers and put out information regularly. There's thousands and thousands of people that do that. Sometimes they get censored and they get warnings and then they get taken down. Sometimes their whole entire site gets taken down completely. And that's just something new in the last 10, 15, 20 years that this has been happening. But I'm talking about the kind of information that I've been trying to get across to my clients for 45 years, over 45 years now. They are not getting the right information. You are not getting the right information out there to be knowledgeable about how your body works and what nutrients it needs in order to function optimally. And if you're sick, how these nutrients have been shown, long established science have been shown to return your body to normal functioning. Okay, which means getting healthier again, recovering yourself from any nutrient deficiency conditions that happen along the way. And like Linus Pauling said, two-time Nobel Peace Prize winner, 99% of health issues are because of nutrient deficiencies. So, we have to be very careful walking that fine line between what gets censored, having just said that right now. That's as far as I'm daring to take it on this channel because I went that far before and I got a warning saying you can't say that, you can't do that. And so other people who this has happened to have taken it even further than I have because I was just kind of pushing the limit to see if I would get censored, and indeed I did. But anyhow, as far as the censorship that the public has been receiving or not receiving, the information they're not being exposed to, there are political reasons. There are many, I believe, sinister reasons why the population is kept sick and ignorant, of how their bodies work and what their bodies actually need to maintain optimal health vibrancy. Okay, so here's some examples. I just did a simple Google search using the search phrase holistic health censorship, and this is the AI result. Now, the AI is learning. It's a highly intelligent, massive computerized system that whenever someone types something in, it learns while it's gathering data. So it's kind of scary that way, but this is sometimes it's good for summarizing information. So I have already come to these conclusions, but it's good to see that AI did its research on the internet and pulled this information for us to look at to summarize it. So here's some examples of holistic health censorship. Censorship of banned books. Some books have been banned on these online websites where you go to publish your book and then it's banned. So people don't have a chance to have access to that, sometimes very valuable health improvement information. Another point is restrictions on online content. Again, like I just said, social media platforms and search engines have been criticized for censoring or limiting the visibility of content related to holistic health, sometimes due to vague or poorly defined content moderation policies, according to the National Institutes of Health. So the National Institutes of Health is a huge database, worldwide database, where research scientists can post their findings through their scientific journals. So there's thousands and thousands of scientific journals all over the world that are submitting their peer-reviewed studies to the National Institutes of Health. So if you do a search on anything relating to your nutritional health or I guess other health management modalities, then you can find research done on the NIH website. So I do a lot of my my research based on that huge database because it's worldwide. And so suppression of scientific research that I have seen over the years. You can tell that the research is very clear on what, in this case, say botanicals can do for the body, their phytochemical compounds, their nutrient factors. Many scientists have already shown what these factors can do for the body, for your health benefit, but it's been suppressed also. So you can see sometimes if you've been studying this industry and watching and researching in this, entrenched in this industry for as long as I have, you can see that there's been some suppression of this research. This research should be broadcasted to the public, but the public isn't receiving this valuable information that the scientists are finding. Also, challenges to holistic practitioners. Holistic doctors and practitioners may face criticism, limitations on their practice, or even legal challenges from conventional medical authorities. So, who are these conventional medical authorities? I don't think there are medical doctors necessarily. A lot of them have good hearts and they truly want to help, but their hands are tied. They're not allowed to become holistic minded or implement holistic protocols for their patients. They have to adhere to what the specific medical authorities have outlined for them, what they can and what they cannot do. So sometimes people have been known to venture out and start administering holistic modalities to their patients, even though they're still registered licensed medical doctors, and they've gotten in trouble for it, or worse. So there has been saying challenges to holistic practitioners is putting it lightly. It's a great understatement. So, reasons for censorship: maintaining dominance of conventional medicine. Established medical institutions may resist the adoption of holistic practices, particularly those that challenge their authority or economic interests. More of that sort of dark undertone, that governs or rules some aspects of the medical profession. Concerns about safety and effectiveness. Some conventional medical professionals may express concerns about the safety or effectiveness of holistic practices, particularly if they lack rigorous scientific evidence. Now, there's the key. Even if they do have rigorous scientific evidence, peer-reviewed studies, the attitude still is, oh, there's not enough research. Oh, it's not legitimate. Okay, so if a holistic practitioner can back themselves solidly with peer-reviewed scientific research, then there is that huge gap of them being able to educate their clients, or if they're a medical professional, educate their patients on this aspect of health management. There's that huge gap that doesn't allow that bridge to cross and integrate. They used to call it integrative medicine. It never really got integrated because I was watching, all those years, and I didn't really see a lot of integration there. So also political and ideological factors. Censorship can also be influenced by political agendas or ideological beliefs that favor certain approaches to health and wellness. More of the same there, right? So consequences of censorship: restricted access to information, like I just said. It's not really restricted. It's there for anyone to do the scientific research, go into the NIH and look at the peer-reviewed studies, do your search term, type in Science Journal peer-reviewed studies on any search term you use, and you'll land at the NIH, page of choices to click on. So there isn't really censorship per se, but it's there. It's that undercurrent hinting that, no, you can't really do that. We won't allow you to do or say that, kind of thing. Also, reduced choice and autonomy. Individuals may have fewer options when making decisions about their health and well-being. Negative health outcomes. Suppressing information about holistic health practices can potentially lead to missed opportunities for improved health and well-being. I have found that to be true. When I received clients, they would come to me as their last resort, after having explored all of their medical choices and countless doctors and a whole list of medications, right? So I wish they had known me sooner. I had clients who said, well, I just started out with a minor health issue, and then I was prescribed, certain medications, and the side effects started escalating because different doctors would say, okay, well, you've got these symptoms now, so I'll prescribe that medication for these symptoms. And so that went on, and it really escalated and made their health worse. So by the time they saw me, I'm not a medical doctor. I never, dared tell anyone to get off their medications. That is not my field of expertise. And I don't ever pretend to be a doctor, but I have the knowledge of what the body needs. The body chooses nutrients so that it can do its repair and regenerative processes, detoxify itself, improve how it functions at the cell level. So, and they got well in spite of the side effects of all of their medications. And of course, their doctors, just kind of scratch their heads and say, I don't know what you're doing, but you're doing better. keep doing what you're doing. And of course, I would try to supply the doctors with the protocol, which was evidence-based. I mean, I would send them, pages and pages of scientific references to justify the kinds of choices I was helping my clients to make, their patient. And so sometimes that clashed, and sometimes they were open to it, kind of secretively, and sometimes they were just outright, rude, and just said, "I don't know what you're talking about." And no, I don't know. I don't want any part of it. And I don't want to read this. And they would not read the scientific research. I think doctors over time now, though, have gotten more and more open-minded and more caring and more curious. And so they're seeing how their patients are getting better with nutrition. Okay, erosion of trust in science and healthcare. So I think there's that element that bothers me. It seems as if uh, there's been this erosion of trust in science because there's so much illegitimate science or poor science or just propaganda that make themselves look like science, but it's not. So of course people are looking at that saying, that's not helping me. That's not going to help my health. But if they were to know the difference between the pseudoscience and the legitimate science, the science that can truly bring about health improvements at the cell level in their bodies, then that's the difference. So there's been an interference, a disruption of that trust and the ability to look for the right information. Okay, so that's what I have for you tonight, everyone. These are my list of references. So you can actually click on these. If you're a member, you can join for only $12.97 a month to month. And, just come to our meetings on Friday nights. We have this Friday Night Lives like you're viewing right now, and you can actually benefit and print out these documents. If you're a member, you can just go back in your member area and you can print out these documents and you can visit these links and just get lost in the wonderful science that's out there waiting for you to show you the truth, okay? And to distinguish and discern the truth from the propaganda. Alrighty, so now if you've never been to my website, those of you out there, if you're new to the channel, welcome, welcome. Please don't forget to like and subscribe. That really helps the channel. And also click the notification bell so you'll get notified of all the new videos that are posted on a regular basis on this channel. So books, descriptions, and book summaries. I've written books. Again, these books have pages and pages and pages of scientific references, of peer-reviewed studies to back up everything I say and do. So these are the books that I've written. You can explore them. There's descriptive videos and just descriptions of what each book does for you. And also you can subscribe to the YouTube channel. I also have a Rumble channel. I don't spend a lot of time there. Things don't get transferred automatically to Rumble when I post something on YouTube anymore. So I have to kind of investigate that as to why that's the case. So if you'd like to join as a member subscriber, then just go to my website. Here, I'll take you there so you can see what it looks like. Let's remove these products here. And I will take you to my website, holisticchoices.com, and just click on True Health Mastery Institute. And that'll give you a description of all the perks and benefits you'll get from being a member. And if you want to join, then you can just click join here, and it's a very easy sign up process. Then you'll have access to videos and articles. There's even an orientation group of videos that you can go through very quickly and get familiarized with all the benefits of what it's like to be a member. And so that is what I wanted to show you here. All right. I also have a course, Nutritional Synergy. It's based on my book, Nutritional Synergy. It's my 14-category food selection system that will ensure that your body gets nourished from all known essential nutrients just by choosing the foods in the system. So you can put together all kinds of delicious, very healthy meals that will benefit your entire system. Okay. All right. So that's what I have for you tonight. I'll go ahead and stop my share. And welcome to the members who attended the meeting tonight. And please stand by. We'll have some more private discussions if it's not too late for you if you're in the back east. But in the meantime, I would like to say goodnight to the subscribers on YouTube. And I hope to see you next time. Thank you so much. Like, share, and subscribe. Tap that notification bell. Much love and health to you. Bye-bye.